Hey guys, this is Manu, physical therapist and herbalist. So in this video, I'm going to show you a neural flossing technique. This is for old low back problems and where you might have had some sciatic nerve issues or nerve root irritation or compression causing pain down the leg. And oftentimes you get adhesions or restrictions, neurodynamic restrictions almost along the path of the nerve. Could be locally at the site of the injury, could also be along path as the nerve goes down the leg to your feet or to your foot. So this is a way to work at doing a neural flossing or mobilizing that nerve in a sheath to improve the mobility of that nerve. Okay, so because it continues to have restrictions, it's going to limit your movement. It can cause pain. It can just impair your overall movement and performance. But keep in mind, you don't want to do this technique in the acute stage of a flare-up of a disc or a sciatic nerve, because that nerve will not like tensioning or stretching that in the initial stages. It'll irritate it further. Okay. So for those of you who have chronic issues and there's some adhesions, and for this you might need a physical therapist, someone to test it out for you, to tell you, okay, this is the appropriate time for you to start doing some mobility exercises to improve the mobility of that nerve. Okay, so we're going to do this in essentially in a hamstring stretch position. I'm going to be laying down on my back, right? My opposite leg is nice and straight. Now I'm going to bring so we're going to do the right leg. I'm going to bring my right knee towards the chest, okay? See if I have adequate hip mobility, okay? As I start to straighten out my knee, I'm going to get some tension. You know, it could be muscular tension, right? It can also be, whether in the hamstrings or as I straighten my knee out further, and if I bring my foot towards me, it could also be calf, right? So it could be muscular tension, but the other part is it can also be nerve tension. So often you'll find that if you have some neural tension in this region, when you straighten out that leg, and if I bring my foot towards me, now I'm really tensioning the whole nervous system, okay? So as I bring my foot towards me, I tug, not only the soft tissue is getting pulled in this direction, but I'm also pulling the nerve. And when I do this, if I have some restrictions here, you can, as you move your foot towards you, feel not only local tension, but you can also start to feel some pain, right? Pulling tension even further up in the chain, all the way up to your back. And in really severe cases, you might even feel it further up, all the way to the shoulder region and shoulder blade region. Or on the opposite side, if it's really, if there's a lot of neurodynamic restrictions in the system. So when you get to a point where you start noticing as you bring your foot towards you, this is a test, straight leg raise test also, where you would bring it up and you bring your foot towards you and it tensions the nerve. But it requires a little bit more knowledge and sensitivity in figuring out whether it's soft tissue or it's just neural restrictions. So have a physical therapist check it out for you. So for our purposes, we're going to bring the leg up, bend the knee towards you. Right? As I start to straighten it out, when I first feel that pulling sensation here, I might say, okay, so if I point my foot away from me, does it relieve some of that tension in this region? Okay, so if it does relieve some of the tension, you know there's some neural restriction that's causing that pulling. But if I point my foot towards me and it brings on that tension, discomfort or pain or pulling, then I know there's some neural tension. So I can work at gently flossing back and forth. So I can control that with multiple levers. So I've locked in this lever, the knee's not moving anymore, this lever is locked. The only lever I'm moving now is my ankle. So I'm moving that back and forth as I'm tensioning, relaxing. I tension, relax. I get it to slightly the end range, tension, relax, tension. And as it gets better, you can straighten out the knee a little more because that puts on more tension again, or I can bring this further towards me and then do the same thing. Now if it's too much, you can relax the knee or the hip lever, so I could bend my knee a little bit and I can still do this movement initially, right? Or I can even relax, bring this away from my body, right? And I can still do this movement too if I don't have enough mobility, okay? So initially when you start, work at doing only for about 30 seconds to a minute and then reassess and see how you feel. How does it feel? Is there discomfort? Is it does it relieve some discomfort after a while when you do that. And the results are not going to be often immediate, right? So the first few times when you do that, don't overdo it. You work at it, do a few repetitions for about 30 seconds to a minute, and then you leave it alone and wait till the next day and reassess and see how did you respond to it. Did it irritate the nerve? Oh, or you had better mobility afterwards, okay? And then as it feels better, you can tension it further and you can do it. You can spend a little more time doing those kind of mobility exercises. All right, this is a good neural flossing technique. You just have to be cautious and careful. Keep in mind, not in the acute stages after an injury, or if the nerve root is really adhesed or irritated, it might not do well with that either sometimes. But usually in chronic stages and when it's not so irritable, this is a good technique, a good way to start mobilizing that tissue. All right, guys, leave a comment if you have any questions, and go check out the site. I have tons of information on it. Thanks.